So welcome to this Legal Aid New South Wales Law webinar about the Healthcare Complaints Commission. My name is Kerry Wright and I work in the Community Legal Education team at Legal Aid New South Wales. I'm here today with Jenny and Jane from the Healthcare Complaints Commission. Hi.
Hello.
Before we start, we want to acknowledge and pay our respects to the traditional owners and custodians on whose land we're broadcasting from today. We extend that respect to all Aboriginal or Torres Strait Islander people joining us today or watching the recording. This webinar will take about an hour depending on the number of questions we get. And as there are many people on the webinar today, please keep your questions brief. If we don't get to all the questions asked today, we'll follow them up by email with you. So we'll start with a quick poll question for those of you who have already joined us. I'm going to launch a poll question. And questions coming up on your slide now. Have you ever assisted a client with a concern about healthcare? So I'm just give people some time to participate in the poll. Looks like we have got some people from regional New South Wales, so that's great as well. So looks like most people have voted, so I'll close that poll and share the results with you, Jenny and Jane. So 64% said yes and 36% said no. So that's good. So Jenny and Jane, do you want to tell us a little bit about your roles at the Healthcare Complaints Commission?
Thanks so much, Kerry. I'll start. Jane, over to you first.
Hi, I'm Jane Probert. I'm the Director of Resolution and Customer Engagement at the Healthcare Complaints Commission. So I deal primarily with stakeholder engagement, with the resolutions function, which is our mediation function, and I also deal with our reviews function. In reviews and resolutions, we would have about 500 each per year. So it keeps us very busy. So I'm going to hand over to Jen, who's our Stakeholder Engagement Officer.
Thanks, Jane. Yes, so I'm the Engagement Officer here at the Commission, and big part of that is our education program. So Kerry, thanks so much for inviting us along today. I'm very happy to help with any questions that might come up. And yeah, very interesting to see that 64% of you have helped clients who've come to you to raise a concern about healthcare. So I'm really hoping that the information that we are able to give you today will help you to direct your clients towards us if they do want to raise a concern about the healthcare they've received.
Great, thank you both. So our next slide coming up, tell us all about the Healthcare Complaints Commission.
So we are responsible for managing healthcare complaints right across New South Wales, and the Commission takes complaints about health organisations, so public and private hospitals, medical centres, clinics. We take complaints about registered health practitioners, so your doctors, nurses, dentists, psychologists, but also there's 15 registered health professions. So we manage complaints about the registered health professions, but also we do manage complaints about anybody who's providing a healthcare service. So even if the practitioner's not registered, if they're a massage therapist, they're a counsellor, an audiologist, a naturopath, anybody providing a healthcare service, the Healthcare Complaints Commission will consider those complaints.
Great. And what types of complaints do you manage?
So the kinds of complaints that we look at are the quality of clinical care and treatment that's provided to a patient or a client. And we also consider complaints about the professional conduct of health practitioners.
Okay. So the next slide's coming up about raising concerns about healthcare.
Yeah, and I think it's one of those things that sometimes if you have a concern about your healthcare, it's where do I start and what should I do first and what are the options available to me? And so here at the Commission, one of the first things, if it's appropriate, that we suggest people do is that you actually do go back to your doctor or back to your healthcare provider and explain to them what your concerns are and see if they can help. And, you know, what we find is that in most cases, health providers will want to work with people to resolve complaints. Quite often they may not realise or understand, there may have been a misunderstanding, there may have been a breakdown in communication, and sometimes it is possible to resolve that directly with a practitioner, you know, and that's going to help to restore trust and move forwards. But look, it's not always going to be appropriate to raise it directly with the person. And at times you may raise it with the health service or with the person and find that you're still not able to resolve the issues. And that's where the Healthcare Complaints Commission can come in. That's where we would suggest that people come and contact us so that we can see about making a written complaint with the Commission.
Okay.
Can I just add before you go is that we do have an inquiry service that can assist. If you have concerns and you're not sure whether we can assist, we do have an inquiry service that will be able to assist you to determine whether the Healthcare Complaints Commission is the appropriate jurisdiction for you, and potentially can provide you with some ideas for how to resolve the complaint yourself. So we do have that facility at the Commission, and it's just ringing the 1-800 number.
And Jane, can I ask a question? Would you also make a referral if it wasn't something the Healthcare Complaints Commission would deal with, like if it's in aged care or something? Mm.
For example, right at the moment, we're getting a huge number of inquiries about vaccinations. A lot of those inquiries, because we don't have any control over the COVID vaccinations and the rollout, we immediately refer to the Ministry of Health, to the relevant area in the Ministry of Health, so that people's concerns can be dealt with by the most appropriate people. So yes, we do. We do have. We will refer people regularly.
Okay, thank you. So the next slide that's come up is tips for raising concerns, Jen.
Yeah, so on our website, we do have there in the understanding complaints section, we do have a few tips there for people, because we understand, you know, it can be quite daunting, I think, to raise concerns about your healthcare and to go back to your provider and talk to them if you're not feeling happy. So we've got a few tips there about what people can do. You know, acting early and talking about the concerns when they first come up is a good idea. And, you know, recognising that perhaps the healthcare provider hasn't realised that something's gone wrong, and giving them an opportunity to have a think about what you said and to come back to you is a good idea. And sometimes just writing down, you know, what the concerns are, because we know that sometimes they can be quite difficult conversations to have. And if you've got some notes there about what you wanted to cover in the conversation, that can support you. Also, normally a healthcare provider will be quite happy if you have someone that, you know, you want to come along with you to support you if you want to talk about concerns that you're having. So the information there on the website might be helpful to some of your clientele if they are concerned about their healthcare and they sort of want to have a little bit of guidance about where to start.
Great, thank you. So here comes this slide, how to make a complaint. How do you make a complaint?
Yeah, so our legislation requires that all complaints must be in writing. So as Jane mentioned before, we've got an inquiry line. They're fantastic. You can ring them at any time and they can actually help you, as she said, to decide, is this something the Healthcare Complaints Commission looks after? How do I go about making a written complaint? They can help with all of those sorts of questions. But if you actually want to formalise the complaint and make the complaint to the Commission, it will need to be in writing. And so what we've done is the easiest way to do it is via our online portal, which is accessible from literally every page on the website. What it does is it takes you to an online questionnaire to fill in, and the really good thing about that is that it prompts you to enter all of the information that's going to help us to assess the complaint. So what happened, when did it happen, who was involved. All of those sorts of things can really help the Commission when we're assessing complaints. So the online portal will actually prompt people to enter the information that we need. But look, we understand that not everybody is, likes to use the computer, and that there are some people that may prefer to actually send in a written complaint. So you can still write us a letter and send it to us. You can email us. You can ring us and request a form to actually fill out by hand. So we don't want there to be any barriers to people making complaints. And the other service that we do provide, if somebody is unable to make a complaint and they need assistance to make a complaint, our inquiries team, can actually have a chat with you, either talk you through the portal and help you answer the questions as you go, or potentially if someone really does need help to make a written complaint, we can organise an appointment, and then that person, the inquiry officer, would actually be able to help the person make the complaint online. So we don't want there to be any barriers. The inquiry service is there to help, and as Jane said, a very good first port of call. But yeah, the online portal is a good way to make the complaint, and you can actually track the complaint as well online if you use the portal to submit it.
Okay.
Being online is quicker as well, because it automatically goes through to our assessment processes and is dealt with immediately, as opposed to if it comes in via mail, it has to be manually uploaded and responded to subsequently. Currently, however, we are in the middle of a quite strict lockdown, and we are not processing hard copy mail at this point. Just so you know, this is just for the moment in the middle of lockdown.
Okay. So I guess that's where community workers can assist their clients then to use the online portal. And I was interested, Jen, when you were talking about making an appointment to talk to someone to fill out the complaint. Can a support worker sit in on that type of appointment as well? I just noticed that someone from a disability service is on our webinar. Would they be able to sit with their client as well?
Oh, absolutely. And whether the person from the disability service was, positioned and able to help the person make the complaint online, which is always a good thing. Again, as I said, the inquiry officers are there. They're there to support and to help when people can't make a complaint. But it is quite a small team as well, and they take over 12,000 calls a year. So, if people are actually positioned to be able to get some support from the wonderful community services that you have online today, that's a great thing.
Yeah, definitely. Okay, so the next slide, take.
Yeah, and this is, I think, one of the key messages that we're keen for people to understand, is that it does actually take some time to assess a complaint. And this, I think, goes back to what we were talking about before about raising concerns locally, if it's appropriate, to see if you can get kind of help with any immediate issues, because our process can actually take 60 days. And the reason for that is that we need to gather all of the information. So generally what will happen when we receive a complaint is that we will generally ask the provider for a response. We may need to obtain clinical records and medical records and look through all of those things. If the complaint is about a registered health practitioner, so a doctor, nurse, dentist, we actually consult with the relevant health professional council. So we co-regulate with them. So they're the subject matter experts. So if the complaint's about a doctor, we would be consulting with the Medical Council of New South Wales so that we can make an informed decision about the complaint. So all of those processes take some time. And, we understand that at the other end of those processes, there's someone waiting for an outcome. But, we do need to be thorough and robust and impartial and objective in all of the assessments that we make. And that process can take some time.
Mm. And one of our audience members have said that they sometimes work as an interpreter in these proceedings. So you use interpreters with people?
Yeah, so people can contact us through the TIS service, and if they need a complaint form in a different language, we can provide that for them, and we can engage interpreter services as necessary. So again, I think that just goes back and speaks to, you know, our commitment that there aren't barriers to people making a complaint.
Okay, brilliant, thank you. So this next slide, the assessment outcome.
Yeah, so we obviously, people will want to know what the outcome of the Commission's assessment of their complaint has been. And so we send a letter to the parties involved in the complaint at the conclusion of the assessment process. And if that person feels that we have missed something during the assessment, we haven't considered something that they've raised that they believe is important, or sometimes just that 60-day process, if the person's still engaged in care during that time, sometimes new information might come to light while we're actually assessing the complaint that we didn't have when we were conducting our assessment. So under those circumstances, there's availability there for people to actually request a review of the complaint. I know Jane was mentioning before, Jane's team looks after that review function. And in an ideal world, it's good that people, you know, we said their reviews really should be lodged within 28 days. But, you know, at times we know that more time may have passed, and we would just consider all of those on a case-by-case basis. So 28 days isn't a hard and fast rule, but we would encourage somebody that if the assessment outcome comes through, believe something has been missed or there's new information to provide, that you lodge that with us as quickly as possible so that we can take another look, and we would have a fresh pair of eyes who wasn't involved in the original assessment have a look at all of that information again, you know, to determine whether or not the Commission reached the right assessment outcome, you know, when we initially assess the complaint.
In some cases, we may even get further advice, peer advice. We might get further information from the facility or from the doctor to ensure that we have covered the concerns of the individual. However, I do want to reiterate that just because you don't like the outcome of the original decision is no real reason to have it reviewed. And we do see a certain number of people who are very unhappy because they have had a bad experience, but it hasn't reached any threshold for us to refer it on for further investigation or for further action. It's unfortunate, but we do have parameters that we have to apply to determine whether an assessment is discontinued or whether further action should be taken. And the unhappiness quotient sadly isn't one of them.
Okay, thanks, Jane. So this next slide is for you to tell us about the different options that outcomes might be.
That's right. So when the Commission assesses the complaint, there's a variety of things that we can consider doing with that complaint. So when we're assessing a complaint, at times, just the very nature that somebody's made a complaint with us and then we, you know, may be in touch with the healthcare provider, and the provider might say, I had no idea that the person was unhappy with the way these things had transpired. I'd be very happy to have a chat with them. And we would obviously go back to the person and check, look, are you happy to talk directly with the provider? They'd really like to have a chat with you about this. So sometimes just the very nature of the communication of the complaint being lodged and the person being made aware that someone was unhappy, quite often these things can be resolved during assessment. And that's obviously a great outcome for all parties for those less serious complaints. And if they can be resolved during the assessment process. So that does happen at times. Some complaints, when we're assessing complaints, really what we're looking for, we're a protective jurisdiction and we're really looking for risks to public health and safety when we're assessing complaints. And so at times we may not find that there's been a departure in acceptable standards of care and treatment, and we may not find that there's actually a reason for the Commission to take further action. And so those complaints we discontinue. It doesn't mean that the complaint is not important. It doesn't mean that the complaint hasn't caused the healthcare provider to reflect on what's happened. So all complaints that are made in good faith are valuable, but at times the Commission may not find a basis for further action. Sometimes as well, we will find like a minor issue, so a small issue, but it's still something that we actually want the practitioner to reflect on and think about. So at times we may actually make comments to the practitioner to say, look, we identified that this occurred, and we'd like you to reflect on that aspect of your practice. Have a look at the appropriate guidelines and, consider ways that we can mitigate the risk of something like that occurring again. So at times the Commission will make comments to a practitioner before discontinuing a complaint. At times, I think I mentioned before that we work with the health professional councils. And so one of the outcomes that can come from an assessment is if the council and the Commission agree that it's a matter that could be handled by the council, those appropriate matters will be referred to the council. And health professional councils have different pathways for helping practitioners to practice safely. So again, we're referring, the matter back to the subject matter experts. They will consider all of that information and determine what it is that they need to do to support that practitioner to practice safely. So we can at times refer complaints back to the appropriate health professional council to work with that person and to consider those issues. We have what's called a local resolution process. So in a local resolution, if we determine it's the less serious complaints again, and they are the complaints that a health service would actually be able to work with that person and to address locally. So local resolution can be a really good outcome in those matters. And so sometimes we will contact the health service, let's just say it's a hospital, and we'll say, this complaint has been raised. Would you be prepared to engage with the person in a local resolution process and see if you can resolve this? If the health service agrees to that, we'll refer the complaint back to them. They'll contact the person directly and see if they can help resolve those concerns. And the health service will send us an update at the end of that process to let us know how that went. So if we think that it's an appropriate kind of complaint that could, something like waiting times, those sorts of things are quite often complaints that hospitals are very well set up. They've got robust complaint mechanisms. They quite often have complaints officers, patient liaison people. They're there to help. If it's appropriate, we may refer it back to them and ask them to make contact with the person and see if they can resolve those concerns. We also have an assisted resolution option, and so the Commission's very fortunate, and this again is a team that falls under Jane's care. We've got a really skilled team of resolution officers. They're very skilled mediators, and they help to facilitate complaints where we can see that there's going to be real value for the Commission to stay involved and impartially and objectively help to facilitate communication between the two parties. For the purposes of restoring trust, that can be very important if somebody's had, a not great experience and they need to return for ongoing care. Those kinds of things might make us look at the complaint and think this would actually be very good for assisted resolution. Commission stays involved. One of our very skilled resolution officers is appointed to that matter, and that person will help both parties to work through the issues and try and resolve the complaint. And I know we were talking before about how complex jurisdiction is in this space, and I think that's one of the reasons why we say at the outset it's a really good idea to contact our inquiry service if you're not sure if it's a complaint that the Commission can manage, because the inquiry services, they understand all of the different bodies that are out there that look at complaints. We've got the Information and Privacy Commission, we've got the NDIS Quality and Safeguards Commission, we've got the Aged Care Quality and Safety Commission, we've got the Personal Injury Commission. There's a lot of different bodies out there which, when you look at health, people come to us because Healthcare Complaints Commission, of course, it's a great place to start. But talking to the inquiry service, what we may find is that some or all of that complaint may be better addressed by another jurisdiction. So sometimes though, if our inquiry service hasn't been involved early in the complaint, we've already received the written complaint, we may find that when we assess that written complaint that those issues would actually be best managed by another body. And so in those cases, we may actually formally refer that complaint to the other body so that they can have a look at the issues that have been raised and determine the best course of action. And finally, there we've got investigation. And this is a smaller number of the most serious complaints that we receive would be referred to a formal investigation. So the Commission has an investigation team, and those complaints are complaints where the assessment of the complaint indicates that there's been a serious risks to public health and safety. There's been, significant departures from acceptable standards of care and treatment, or there's been conduct from a practitioner that if we substantiated that conduct, it would prove grounds for disciplinary action. So it's a smaller number of those more serious complaints would be referred to our investigations team, and they would obviously be taking a deeper dive into that complaint material to determine what the appropriate outcome should be. So there's a range of things there, there's the pointy end that we just talked about, and then there's obviously those complaints that, we do discontinue because we don't find that there is any need for further action. But there's also a lot of things that we really do try to do to resolve complaints. And that's also an incredibly important part of protecting health and safety, because there's that education factor, there's that reflection factor, there's bringing parties together to actually talk about concerns, and all of those things actually really do strongly contribute to improved health services. And that's why we say, all complaints made in good faith are important.
Okay. What's more, we do actually look at it with all the discontinued complaints and discontinued with comments complaints. We do look at them to see if there are any trends. And if we find trends, we can actually educate to ensure that practitioners in a particular field actually have the understanding of what's arising in complaints, so that we do assist in ensuring that issues don't happen continually the same way. So, we do have a remit that looks holistically at complaints to determine how we best approach them from an education point of view, or discussions with different groups of people. Maybe it's the Aged Care Quality and Safety Commission, so that we collaborate to ensure that the different groups do understand what we're seeing and how we can best support them in understanding how to best fix the problems.
I've got a question here which you might be best to answer, Jane. It says, in relation to trying to resolve complaints, does the Healthcare Complaints Commission work with patient safety officers and reportable incident brief processes?
We do. We do have a relationship with Patient Safety First. We do, in many cases, particularly in relation to resolutions, where there has been a very bad outcome, a death, possibly, and the family wants some sort of closure and understanding in relation to what happened. We will work with the Patient Safety First groups. We will look at the RCAs, or sorry, old language, but the reporting, to ensure that there is nothing to be seen. We do get quite a lot of information in the tragic complaints where people die. We make sure that we've covered off we've uncovered every stone, so to speak, in terms of what was the reporting, what was done by the facility, what was done by the LHD. So we do look at all of that information. Jen, did you want to add anything to that?
No, I think you've covered that.
So we do take things, no complaint is taken lightly. And we do look at everything. If we're not understanding what the issue might be with the complaint, we will contact the complainant and talk through it with them to find out what the real issue might be, or the real sticking point is, so that we can address that appropriately with them.
Great, thank you. So, Jane, you're going to take us through this case study?
Yeah, So we have a complainant in this case study. A carer made a complaint about her sister's experience during a hospital admission. Her sister had an existing disability and was profoundly impacted by the hospital stay, which involved a traumatic diagnosis and a complex treatment plan. The carer raised concerns about communication issues, lack of patient-centered care, and psychological support. Now, where do you think this would sit in our matrix of how we would manage that complaint? What outcome do you think might be the most appropriate outcome for this complaint?
So I'll launch that poll now so people can share their thoughts with us. So which assessment outcome is suitable for this case? So we'll get people to vote to see. They're probably all reading them and thinking about it. Oh, here we go. People have started to vote. Choosing which one they think would be the best outcome. Waiting for a few more people to do that. And then I'll share the results with you so you can see what people chose. And then we'll share the actual outcome. You can only choose one. People are probably thinking, oh, I want to choose more than one, but I set it up that they could only choose one. So
there may not be one correct answer.
Well, that's right. I'm sure it's complicated, so it's hard to say that. But I'll close that now and share the results of how people have voted. So 50% said local resolution, 38% said resolved during assessment, and 13% said refer to assisted resolution. So I'll hide that and bring up the actual what actually happened.
Okay, so this could have gone two ways. In this case, it was assisted resolution because the nature of the complaints that were being made were such that the party, well, the complainant and her sister needed extra support to be able to discuss the issues and to have their issues heard appropriately. So a resolution officer facilitated a meeting between the parties with the aim to explore issues, restore trust, consider any learnings or actions that may support future care. And it was impartial and voluntary process for both parties. Now, it could very well have been a local resolution, but there are times when in local resolution we just say, would you like to go back to back to the LHD and have a talk to them about the issues? A lot of them will say no because they haven't had a great response from them in the first place, or they perceive that they haven't had a great response. Assisted resolution allows an independent third person to be able to navigate the exploration of those issues, to get more information, and to get people in a room which is a very safe place for all the parties. It's a great outcome, but as I said, we could have done local res, and if it was a simple issue, it could have been resolved during assessment, but most of these type are unlikely to be resolved during assessment. But resolved during assessment usually relates to getting a new appointment or to getting their medical records, those sorts of examples. Local res and assisted res, it depends on the heightened nature of the complainant and their interactions with the facility or the doctor or whomever.
I think as well in this case, it's, the person's going to have to go back. They're going to need to continue to access care, and it's so important for that person and the carer and the sister that's involved to feel like trust and confidence in that process. And I think sometimes, as Jane said, that independent third party who's there and impartially helping the parties to communicate, well and effectively, and to try and reach a resolution could potentially restore that trust and help that person feel safer with the ongoing care that they need to access.
Many times when we have a difficult patient facility or doctor relationship, well, it's usually facilities, we will try and broker and ensure that even with a difficult complainant who may have mental health issues or be quite heightened in their emotions and have caused considerable angst in the past by attending, say, ED and yelling at people, we will broker a care plan for them to ensure that no matter how they present, that they get the care that they need. And assisted resolution is a very good vehicle for that, to ensure that the care is still available. We have had people who have said a particular facility won't have me come to, they won't let me come and see them. And it's the only facility in a particular area, and that's when we do try and broker some sort of care and treatment to ensure that they are protected.
So
and
just
if that's the sort of,
yep, sorry, keep going.
If that's the sort of issue that is really on the table when you're dealing with your patient as a carer, we would like to hear that so we can see if we can, as soon as possible, assist in brokering that relationship.
Yeah, that's an important point. All right, well, we'll move on to our next case study. You're going to take us through that one, Jen?
Yeah, so in this case study, the Commission received a complaint from a man who, had significant bruising inside his elbow resulting from cannulation after a day procedure. So we contacted the provider, who explained that bruising is, an unfortunate but not uncommon side effect of cannulation. And at the time, a pressure dressing was applied when the cannula was removed, and the patient was provided with aftercare instructions. So,
all right,
having a little think about the options.
Which assessment outcome? I'll launch our next poll, which brings up the options. So which assessment outcome is suitable in this case? So I'll just give people some time to read that and vote for what they think is an appropriate outcome in this type of complaint about a man who had bruising inside his elbow resulting from cannulation after a day procedure. So people are voting. So I'll close that and share the results with you both. So we've got 58% said resolve during assessment, 17% discontinue or discontinue with comments, and 25% said refer to an appropriate health professional counsel. So I will hide that, and Jen, you can take us through the actual outcome.
And again, this is something that could go two ways. So I think people that have chosen resolve during assessment, this is very much the kind of complaint that may be also resolved during assessment, because, it may just be that the person that's experienced the problem with bruising didn't expect it, maybe got a bit scared by, having a big bruise inside of their arm, and by actually some reassurance that this is normal and it's unfortunate, but it can happen, could put their mind at ease and help us resolve the complaint during assessment. But if we were unable to resolve it during the assessment process, it is probably the kind of complaint that would be discontinued, because it wouldn't necessarily represent a departure in the standard of care and treatment that's been provided. Bruising can occur from cannulation, the proper dressing was applied, aftercare instructions were provided, there hadn't been a departure from acceptable standards of care and treatment in that complaint. So yeah, absolutely resolve during assessment, or if unable to be resolved during assessment, it may be the kind of complaint that's discontinued. But again, still a valuable complaint. Potentially the practitioner involved may, communicate better around cannulation in the future. Look, you may get a little bit of bruising here, just reassuring people. And so quite often complaints can lead to, improved health service delivery, because it does encourage practitioner and health service provider reflection. So one that we wanted to land on at the end of today.
Mm. Do you have anything to add, Jane?
Not at all. However, I can tell you that this one, to be really frank, actually went on review. So we can get some very minor issues that come to review, as much as we can get some very serious issues that come to the review. And on review, there's very few, but there's 1 or 2 a year that would actually go to investigations once we've reviewed it. Because we get further information.
Yeah. So what you're saying is they got their outcome and then they asked for a review, and that's when you've got more information.
Yes, absolutely. Well, in this case, really, there was no departure. There isn't much we could do. The individual was very upset with the outcome and the bruising. So we just had to reiterate that this is what happens, and unfortunately, it's a risk of having a cannulation, and that there is no risk to your health and safety.
Okay, thank you both. They're great having those case studies. So, Jen, the slide coming up is about how to get in touch with the Healthcare Complaints Commission.
And I think if there's any sort of takeaway messages from today, because I know all of you online today are incredibly busy people, you're trying to help members of the public that are coming to you for support and advice, and understanding everything about every single service is an impossible feat. And so, our inquiry line is there, and if there's any takeaway from today, if someone's approaching you with concerns about their healthcare, encouraging them to get in touch with our inquiry line is a great start. So there's a 1-800 number there that people can call. And look, you don't have to tell us who you are. You can stay confidential. You can ring and just say, look, this has happened. I'm not really sure if this is something you deal with. Is it another body? Please to call that inquiry line with any questions. Also, our website is a good source of information. So if you're not sure about something, jump onto the website, have a look there. It's laid out pretty cleanly, and you can generally find information that you need on the website as well. And of course, as well, that's the good start point for actually lodging a written complaint via the portal, because from every page you can access the complaints portal when you're ready to make your complaint. And the other offer that I just wanted to put out there today to anyone that's online is that we do have, some trifold brochures. We're very happy to send those out to any services out there. If you'd like to have some on hand, you can contact Kerry in the chat today and let her know that you'd like us to send some out to you, and we can send some out to you so you can actually hand those out to people. It covers a lot of the information that we've talked about today, and will help people understand the service a bit better.
Can I just add, we like feedback. If you look at our website and you think that it might need some further information, we would love to hear about that, and there is a feedback loop on the website. If you're assisting someone with making a complaint and you get you see the outcome letter when it's resolved, we do have a survey that's attached to pretty much every assessment letter and every resolution letter. We ask you to have help give us further feedback by responding to the survey. It's a way we can learn how we can do things better and what we need to do to improve. So we would really appreciate that as well.
Great, thank you. So that 1-800 number is 1-800-043-159, and the website is www.hccc.newsouthwales.gov.au. So we've come to the end of the webinar. So if anyone has any questions, now's the time to type them into your question panel so we can ask our presenters if they can answer your questions. As Jen mentioned, you can also put in there if you'd like us to send you some brochures, or in the follow-up email that you'll get after I close the webinar, there is an email address where you can email and say, could you send me some brochures to have for my clients? Obviously at this difficult time, it's hard to see clients face to face, but for when we all open up and people can access our brochures again. So I do want to thank you both, Jenny and Jane, for your time today and sharing your knowledge about Healthcare Complaints Commission with our audience. Just waiting to see if we get any questions. Okay, no, I've had a thank you. Have a great day.
And you too.
Haven't had any questions, but it might take a little while to come through with the internet. Yeah, so and also just to remind everyone that, like Jane's saying, they like feedback, so do we, and you'll get a survey after we finish. Here we go. No, we're just, people are asking, just saying thank you, really. No, there's no questions there. All right, so that's quite a lot of information to absorb, obviously, coming through this webinar. So in about an hour, you'll receive an email with links to the resources and websites we've talked about today. Keep that as a handy reminder of the information. We've recorded this email. It will go up on the Legal Aid New South Wales YouTube channel. So have a look for it, as well as all our other recorded webinars. Someone has sent us a question. COVID has made it hard to get evidence from clients. How would you recommend we follow up complaints in the health space? Do you expect supporting documents?
Not always. The more information we have, the better we are. However, we can actually request request health documentation, and that's part of our assessment process. So it shouldn't stop you from putting a complaint in. But the more information that we have, the more in depth we can assess the issues. Jen, did you want to say anything else?
No, I think just include as much as you have. You know, we understand the situation at the moment is difficult. If you have supporting documentation, great, include it. If we're assessing the complaint and we feel that we need more information, as Jane said, we can actually contact the health service provider and we can retrieve what's required to assess the complaint.
Okay, thank you. That seems to be the only question. Someone's asked whether I'll be sending the recording. No, you just go to the Legal Aid New South Wales website on the home page and click on the YouTube link and it takes you to our YouTube channel and look up video recordings of our community legal education webinars. Okay.
Can I just make one last point,
yes,
just about assessments? That point that was raised about it being difficult getting responses from providers, that is true. Some of our assessments, I know we have up to 60 days. Some of them are taking a little bit longer at the moment. And that's because the local health district or the facility, usually they're in a bit of a world of pain at the moment, particularly in the Sydney region, the Greater Sydney region. So please bear with us. We are trying to deal with these matters as quickly as we possibly can, but some of the hospitals are a little fraught with managing COVID. So it will take a bit longer for us to get responses. So it may take longer to have an assessment or a review undertaken, or a resolution for that matter. So please bear with us. It's not that we're not working on matters, it's taking a little bit more time sometimes than we thought usually happens.
And I think, Jen, you said when you lodge it online, you can then track it, is that right? So
Yes.
people can check in.
That's right. So you can see where it is. Once you've submitted it, you'll see it's been submitted. You'll see if it's pending, and that means that we're waiting to assign that matter to a case officer. Once it's been assigned, you can see the name of the person who's looking after your matter, their contact details are there, and you can actually provide additional information through the portal, during the process as well. So, the online complaints tracking mechanism, is available to people who've lodged their complaint through the portal.
Great, thank you. Well, everyone's just saying thank you. So I think we'll say that that's the end of our webinar. As I said, when we close the webinar, we'll get a survey. You'll get a survey about this webinar, and we appreciate your feedback. You'll get that email with all the links. And if you're listening to this webinar as a recording, please email any questions you've got to the email address on the slide now, cle@legalaid.newsouthwales.gov.au, and we can pass them on to Jen and Jane to follow up. And of course, if you've got clients with legal problems, feel free to refer them to Law Access New South Wales on 1300 888 529, and they will help work out the best agency to help with those. So I think we'll close the webinar now, and thank you again very much for your time today, Jenny and Jane. Good luck with all your work during this difficult time.
And to you.
Thanks.
Be
Thanks
safe,
for having
everybody.
us today. Thank you.
Bye.
Bye.
Bye.